This is Callum. He's 24 years old. Just like 45% of people who go on to become homeless, he has a diagnosed mental health condition. We chose to focus on rural parts of Scotland classified as remote, that is, more than a 30-minute drive from the nearest settlement of over 10,000 people. Callum is from Orkney, which falls under this category. Due to his mental health issues, Callum is asked to leave his accommodation. Mental health is a direct contributor to homelessness in 17% of cases. Up to 80% of homeless people in rural areas have mental health issues. This is considerably higher than the Scottish average. Callum goes through the process of registering as homeless and applying for accommodation. It usually takes over 8 months for individuals to be given a permanent residence. Applicants are also assessed for other requirements or needs. In remote rural Scotland, 37% require additional mental health support.
Temporary allocation rarely meets the requirements of the applicants. The use of B&Bs is decreasing during this transition phase, and the Scottish Government has implemented the Housing First policy that aims to provide stable long-term accommodation. Once permanent accommodation is allocated, it is usually in a different area, which means Callum has to build new social ties and integrate into a new community. Most local authorities, particularly Orkney, have comprehensive support structures and services in place, adapted to Callum's special requirements. Examples include supporting employment service, Orkney Blood Trust, and the home support team. The main issue that we have identified in these regions remains transport. The poor public transport assistance and remoteness only aggravate mental health issues. Our proposal is a rural community bus scheme. This would consist of a community-led service, where bus trips are coordinated by the requirements of community members. Local authorities could administer the system by investing in the platforms and infrastructure required. The service would be open to the whole community. We suggest that an app is designed specifically for this service. It should be easy to access with minimal registration steps. It's also important to ensure that it is fit for users with mental health issues. This is one reason why an app is suggested as an alternative, because calls are hard to make for people with mental health issues.
To further enhance accessibility for all users, we suggest the implementation of multiple ticketing systems, for example, online using cash or through the app. What this scheme does is improve connectivity for individuals like Callum. The rural community bus would allow him to attend programs which help him address his mental health challenges, as well as reduce barriers to other social activities or job interviews. This is why we strongly suggest that local authorities ensure that this service would be free for those who are homeless and those who have been given permanent accommodation in the last 2 years. This would greatly facilitate Callum in discovering his new community landscape, increasing the chances of him integrating and dealing with his mental health challenges. The issues with public transport and the role it plays in dealing with mental health issues, particularly in rural communities, has been highlighted time and time again, as vouched for by these testimonies.
One example of a similar scheme is the village one, as implemented in rural Sweden. This was a service entirely led by locals, whereby members of the community would themselves drive the van and coordinate route and frequency. In part of Scotland, a dial-a-bus scheme has been put into operation, whereby users can book door-to-door trips in advance. It is specifically gauged for elderly individuals, but has not yet been introduced to more rural areas. Its success is a promise for the principles of our proposed project. The My Bus scheme was expanded as part of All Aboard scheme led by the Scottish Youth Parliament in improving youth mobility in rural Scotland.
By bringing the community together, the project works to reduce social isolation, stigma and loneliness, thereby improving mental health and decreasing the risk of homelessness amongst rural communities. This scheme aims to reduce youth homelessness by providing better access to crucial services and strengthening rural communities for a better Scotland.